This is Dr. Arun Mukka, consultant endocrinologist at Yashoda Hospital. The question which many patients ask is, Doctor, what kind of vegetable food and what kind of non-vegetarian food should we be consuming as a part of dietary regimen for controlling our diabetes? Let's try to understand what needs to be taken. Now let's talk about the vegetarian diet. Now, very important thing is the quantum of the food. See to that the quantum of food is not more than the required amount for that person of that age and as well as weight. Now, coming to the types of vegetables that can be eaten, majority of the times vegetables need not be restricted provided they're not processed too much. Not too much of deep or stir frying should be done. Most of the times the vegetables are encouraged to be taken in the boiled form of curries. The tubers, that means those vegetables which grow underground, are to be restricted, like potatoes or the sweet potato kind of vegetables. The ones which grow over the ground, like all the gourds and all the vegetables, leafy vegetables, dals, can be taken in abundant quantities or liberal amounts to satiate the person instead of taking too much of rice or chapatis. See to that the vegetables or the curries are not deep fried, they are more of a boiled kind of vegetables. Now, replacing part of the meal by snacks or the salads or the sprouts, we can bring down the glycemic index of this food so that the food is digested slowly. The amount of the sugar elevation after the consumption of the meal can be brought down by partly replacing the meals or adding sprouts and salads to the meal. Now, when coming to the non-vegetarian food, meals or the meats which have got high fat content, like the red meat, like the lamb meat, should be restricted, like the camel meat, that should be restricted. Chicken, which contains higher quantity of protein, can be encouraged to be taken once or twice in a week. But the foods or the non-vegetarian meat products like the fish, which has got abundant amount of the fish oils, which are known to confer protection from the heart attacks or the cardiovascular point of view, they can be taken in a liberal way. We can encourage the patients to take the fish either in the grilled form or in the boiled form at least 2 to 3 times a week. That is beneficial. However, if the fish again is fried, again the medicinal properties of the fish are lost and it becomes a very useless thing. So a fried form of fish should be avoided, whereas the grilled as well as the boiled form of fish can be taken. Now, when it comes to the fruits, try to eat the fruits in their natural form. It is not advisable to take the juices, as the consumption of the juices can elevate the sugars in a rapid way. The fruit should be consumed in the whole form way. Certain fruits which contain high glycemic index like mangoes, the sapotas or the grapes, which can cause rapid elevation of the sugars, to be avoided. Whereas certain fruits like apple, guava, raw papaya, melons can be taken in a slightly liberal amounts, as they are known not to cause too much of sugar elevation. Whereas the juice form of any fruit can cause a rapid elevation in the sugar, so they need to be avoided. Try to take the fruit in its natural form. Thank you.